Good morning. I am Roy Charles Brooks. I am a county commissioner from Tarrant County, Texas, which is Fort Worth for the uninitiated. I want to thank you for that kind introduction, and to thank Mr. Bertolini for joining me in this discussion this morning, and to thank Atlantic for hosting this event and Aetna for supporting it. Thank you also to Aetna and the Aetna Foundation for your partnership with NACo as we work together to improve county health. I also want to thank our partners in the Healthiest Cities and Counties Challenge, the American Public Health Association, and CEOs for Cities. Now, this conference seems to be focused on cities, but I'm a county person. As first vice president of NACo, I represent all 3,069 counties in America. And counties across the country play a major role in healthcare delivery and innovation. For instance, counties spend approximately $83 billion a year on health care. So we're involved. It's good to have the opportunity to participate with Mark in this discussion, so let's get at it.
Good thing.
The healthcare community is moving away from a focus on clinical care and towards a holistic view that includes the social determinants for health. What are the factors behind this shift?
Well, let me start with a little context. Aetna has one of the oldest corporate foundations in America. We started it in the 1970s when the city of Hartford went bankrupt, and we made the city of Hartford payroll for a year. And we said, we probably ought to do this a little more formally. And since then, we've given more than $500 million away to various community efforts. Over the last 5 to 10 years, we've actually started to focus on issues around racial and ethnic disparities, something I know you share as a concern with me, Roy, with different forms of delivery of care, and then with the whole idea of food deserts and getting at the issues of obesity. For example, over the last 2 years, we've started 120 urban farms a year in communities to help eliminate food deserts and to connect communities to healthier food. And so as we started looking at all these challenges and the challenges of our own employees, which were, as I tour the country, I meet with each of our employee groups, and then I go and shake everybody's hand in their cube and thank them for their work. And I was hearing about how difficult it was to make ends meet and how little they had in the way of personal disposable income. So we started to look at our own employees to find that we had 20% of our families on food stamps, 30% of our employees' children on Medicaid. And so that's when we decided we need to raise our minimum wage from $12 an hour to $16 an hour and to eliminate out-of-pocket costs for our employees.
I would applaud that. I don't know about you all.
And then we started investing in mindfulness, and we started investing in tuition reimbursement, and we started investing in student loan repayments. This year we will launch a program where we'll pay back $2,000 a year of student loans, up to $10,000 for our employees, as we try and help them move forward in this economy. But the issue has been, these are all programs. Mm-hmm. They're not approaches. And as you know, in communities, you need holistic approaches. Because it's like a balloon. If you squeeze it here, it'll pop out somewhere else. And it hit me a year ago. I was on stage with Sir Michael Marmot, Nobel laureate of social determinants, at Columbia University doing grand rounds. And I was talking about how our economy has laid bare social determinants in healthcare. And he said, Mark, we've known that since World War II in Europe. And as we started to look at our spending here in the United States versus European countries, the United States is now 12th in total spending on social determinants and on healthcare, whereas among OECD nations, but we spend more than 70% on healthcare, while those countries spend less than 50%. So there's something wrong with the balance. And that's when we said, how can we work and figure this out? Well, we need to get to communities, we need to get to counties, we need to get to cities, and we need to hear what they need specific to their own communities. And that's why we've launched this program called Healthy Cities Challenge. We can bring resources and ideas. How can we work with cities and counties to help develop programs to get at these issues of the balance between social determinants of health and healthcare spending?
What do you think are the most pressing health challenges that local communities are facing, and how can we collectively work to address them?
Well, having been born and raised in Detroit, Michigan, water, food deserts, Maslow's basic hierarchy needs, safety, shelter, are really huge determinants. You can't self-actualize and walk 30 minutes a day and make sure that you're in physical shape if you're too busy searching for food, for shelter, for safety, and for water. And so the very basic needs are being overlooked. And as those become overlooked, people can't begin to take care of themselves. And that shows up in higher healthcare costs. So it's things like healthy behaviors. 10% of our healthcare costs are driven by clinical care. Yet our whole industry and our whole healthcare system is focused on clinical care. Somebody gets sick, they show up with a card, and they get fixed. 20% are based on social determinants, 30% are based on genetics, and 40% are based on behaviors. You can't have good behaviors if you're paying too much attention to the basic needs. So with more than half of the world's population now in cities, your zip code matters more than your genetic code in your health. And that is something we have to address.
What role do you think businesses or corporations have in addressing these challenges and improving the social determinants of health?
So 2 Christmases ago, I bought my team a copy of Thomas Piketty's Capitalism in the 21st Century and said, here's your holiday reading. This is...
There will be a test after this.
Well, I didn't test them on the formulas, but I tested them on the concept. And it talks about forced wealth redistribution as a way of getting income inequality resolved. I said, we have a choice. As the country that, quote unquote, and I use the term very loosely, perfected capitalism, we now have a problem. Our capitalist model doesn't work. It's leaving too many people behind. And so how do we take our system that we invented and run and reshape it in a way that we can then begin to turn businesses into social ecosystems, people, planet, then profits, as a way of reestablishing community at the local level. And the only way we can do that is in concert with local communities. So this idea came about as, if we're going to be about people, planet, then profits, who do we need to partner with to make that happen?
So given the fact that social determinants and personal behaviors, which are in many ways dictated by these social determinants, are such large factors in the health status of our communities, how is Aetna working with state and local organizations to improve the social determinants and build healthier communities?
So we need a partnership. We need to give cities and counties resources to be able to put together plans that address the issues in their own environment, right? So healthy behaviors, community safety, built environments, bike lanes, parks. As you'll hear in a few moments, Ken Thorpe is going to talk about the studies. When you invest in parks, you actually improve the health of a community and its physical fitness. We did that, by the way, during the Depression with the Conservation Corps. Why haven't we done it over the last 8 years? here in the United States. If we're looking for shovel-ready projects, we got a whole set of parks and communities that we could be doing this with. How do we encourage more urban farms across the United States? How do we, my better half, she's one of these yogi kind of people. She wants to do blue-green algae on rooftops, like they're doing with the Fukushima nuclear reactors in Japan, trying to replenish the environment. But what are all the things that we could do? And each community is different. So we can provide the resources to help the planning. We can help set the stage for measurement. And then we can work with you as you work in your community to make those investments and watch what happens. And then let's take the best practices, which is what the Healthy Cities Challenge is all about, and let's then scale those across the United States in partnership or reestablishing community. We have lost community in the United States because of the Industrial Revolution, the Information Revolution, and the Knowledge Revolution. People have lost importance to machines. Our tax systems, our accounting systems make machines more important than people. And what do we do to reestablish community? We have to get back into the communities and build our economies around that. Our view is a healthy person's productive. A productive person is spiritually, economically, and socially viable. And viable people are happy. And wouldn't our nation be a little better off if we didn't have to pay attention to the incivility we'll hear tonight because we want to blame everything on everyone else, right? And if we were happier, we wouldn't behave that way.
I'm going to take a risk here and ask one further question. You have told me that you grew up in Detroit, and you are very familiar with the social and economic conditions that Detroit is facing. How do you take the power of corporations and the power of local government and blend them together into a team that can affect a city that is so far down and people who have to live there?
Yep.
How can we work together to improve those intractable problems?
Well, it's already happening in Detroit, actually. I get back there often. I used to work in the Cass Corridor in Detroit on an ambulance in Detroit Receiving Hospital. And that neighborhood's fundamentally different these days. I ride my bicycle there now. And what they call the slow roll on Thursday nights and Monday nights. And it's really a much safer community. You have companies like Shinola, which took the shoe polish company and make watches and bikes, of which I have both. And they have now imported people from Brooklyn, which has become too expensive for a lot of people to live. And actually in Brooklyn, there are now billboards that say, next stop on the L train, Detroit. And people are gentrifying Detroit from Brooklyn and New York because it's now the cool place to be. So all we have to do is bring business in, small business, let them grow and flourish, take advantage of the cost structure, which will help small businesses start, and together with the county and enterprise zone, which is what Mike Illich and Karamanos and all those folks in Detroit have done. What can we do to then take that enterprise zone and turn around a whole city? And I think it's going to happen. Plus, we're doing urban farms there in the periphery because there's plenty of empty lots. My neighborhood's one of those empty lots. And we can grow food in the community and reestablish community and get people to move back in. And I think that will happen in Detroit. We saw it happen in Brooklyn. We've seen it happen in Harlem. Mari and I work with Harlem Grown, where there's a lot of good stuff going on. So, well, good things.
We're getting the hook.
We're getting the
now.
hook.
So on behalf of cities and counties, I look forward to working with Aetna and other corporations to help rebuild the places where we live.
Thanks, Roy. Nice watch, by the way.